This is a musculature anatomy review of the spine. Beginning on the anterior aspect, we will look at some of the primary core muscles. The first of which we come to are the external obliques, seen here. The external obliques have fiber orientations that run down and in towards the pubis, like so. The external obliques have an origin on the external surfaces of ribs 5 through 12 and an insertion on the anterior part of the iliac crest and abdominal aponeurosis. Unilaterally, the external obliques rotate the trunk to the contralateral side and laterally flex the trunk to the ipsilateral side. So the right external oblique, which is highlighted here, will, when contracting unilaterally, rotate the trunk to the left and laterally flex it to the right. Bilaterally, the external obliques flex the trunk. If we remove the external obliques, underneath them, we have the internal obliques, which have a fiber orientation running up and in. The internal obliques have an origin along the inguinal ligament, iliac crest, and the thoracolumbar fascia on the posterior aspect of the trunk. They insert on the internal surfaces of ribs 10 through 12 and along the abdominal aponeurosis. Unilaterally, the internal obliques rotate the trunk to the same side, the ipsilateral side, and laterally flex the trunk to the ipsilateral side. So again, the highlighted right internal oblique here would rotate the trunk to the right and laterally flex the trunk to the right. Bilaterally, the internal obliques serve to flex the trunk. Beneath the internal obliques, we see everyone's favorite core muscle, the rectus abdominis. The rectus abdominis, of course, gives the famous six-pack. It has an origin on the pubic crest, pubic symphysis, and inserts on the cartilage of ribs 5 through 7, as well as along the xiphoid process of the sternum. The action of the rectus abdominis is to flex the trunk, and it assists with posterior tilt of the pelvis. If we remove the rectus abdominis muscle, underneath that, we see the large and deep transverse abdominis. This muscle originates along the inguinal ligament, the iliac crest, and the internal surfaces of ribs 7 through 12. It inserts along the abdominal aponeurosis and has the action of compressing the abdomen and is active in expiration. The transverse abdominis is one of those muscles that is key for setting the core.